morning. My name is Tay. I'm going to be your student nurse for today.
Good morning.
Can I have your name and date of birth?
Charlotte Hayes, 6/13/76.
Hello, Miss Hayes. Today I just want to inform you of some information. Is that okay with you?
Yes, ma'am.
Okay, I'm not going to take up too much of your time. I'm going to teach you about Clostridium difficile. It's also known as C. diff. I'm going to tell you a few ways we're going to be reducing it. C. diff is basically an infection in your colon that causes you to have a lot of diarrhea, like non-stop of it. So it affects a lot of patients who have cancer or weak immune systems, which means they're just very sick and their body is not strong enough to handle things. We have this 5-by-5 step method that we use now to help deal with the infection. We tend to focus on high touch surfaces known as your bedside table, bed rails, your call light and telephone, IV pumps and the poles. Those are the main areas we're basically most focused on because they're frequently touched every day by people, so they carry the most germs. Also, it teaches you to focus on teaching the family and the patient on importance of hand washing. But we leave hand sanitizer at the bedside of patients who are alert, which just means you know where you are, the time of day, the date, why you're here today. Those type of patients that basically have their memory together. We'll give them hand sanitizer, but it's really important to use soap and water to wash your hands. That really kills the bacteria. So can you just teach me a few things or tell me a few things I just informed you on?
It is best to sanitize and wash your hands. Sanitize everything and wash your hands often with soap and water.
Yes, ma'am. Also, research have showed that they used to use a black light to examine the rooms to see if any bacteria was still on the walls. It's just a light they shine to see if anything's left. But since research showed that the ratings was down, we now use Clorox wipes, also known as hypochlorite, but it's just basically wipes with Clorox or bleach in them. It's a strong chemical to kill germs. So we're going to be using those to wipe down your beds and walls while you're here. But when you're in the bed, we're not going to do it. We're mostly going to do it when you're out of bed, because the smell makes a lot of patients sick, or some patients just can't handle the smell. And we're going to make sure we're using damp mops to mop your room daily. We're going to be cleaning your bathroom daily. We're going to use towelettes. Make sure that after each use, when we put them in the trash, we're discarding it immediately to keep the germs down, because just by touching things, it can spread the infection more.
Right.
Also, excuse me, we're just gonna make sure that when patients come visit, that we inform them of what's going to be going on daily, because they can also get the virus just by touching simple things in your room or going in the bathroom after you and we haven't cleaned it.
Right.
So can you just tell me a few things that I just informed you on?
So instead of using the black light to predict where it's located, we'll just use bleach wipes to wipe everything down, bed and restroom, right?
Yes, ma'am.
Okay.
Do you have any questions to ask me about the infection?
No, ma'am.
Okay, well, we just wanted to keep patients updated due to hospital stays. They have a higher rating of this infection in the hospital that patients tend to get a lot. So we just want to inform every patient of what we're going to be doing to prevent them from getting this infection at all, especially our terminally ill patients.
Okay.
But I just wanted to thank you for your time today. I'm going to go document to say that I informed you of this.
Yes, ma'am.
And I'm going to perform my hand hygiene.
Yes, ma'am.
Make sure you're comfortable and your call light is in reach, bed locked and low, and if you need anything, just give me a buzz.
Thank you, ma'am.
You're welcome.